Welcome back to another episode of Thriving with Rachael and Dr. Lou. Happy New Year, everybody. Thanks for joining us. Tonight we have Lauren Rudolph, who is head of our trauma track here at Sonari today, joining us to answer questions about how to thrive through traumatic experiences. And I know we had several questions that already came in, and we have a couple people logged in so far. Lauren, I'm not sure if you want to do a quick intro of you real quick, and then we'll get started.
Sure. Hi, I'm Lauren Rudolph. Thanks for having me on the show. I just run two trauma programs now at Sonari today. One of those is specific to complex trauma, which is newer, so I'm really excited about that. And I've just spent most of my time in the field working on just getting to the root cause of a lot of our symptoms that we're seeing with mental health and substance abuse. So I'm really passionate about working with trauma because that's often at the root of those symptoms. So thanks for
That's a
having me.
great point, Lauren, that trauma is a part of so much. I'm wondering, is there like a percentage of people who have trauma? Do you, do
Yeah.
you know what that looks
Yeah.
like?
I would say the numbers are probably higher than what is reported. I believe in terms of people who experience a traumatic event, that's at least 50% of the population. And then individuals who develop trauma symptoms have it at about 7 or 8 out of every 100 people will develop PTSD from traumatic experiences, which is, yeah,
So
pretty
people
common.
can have trauma, but not necessarily develop PTSD. Is that right?
Correct.
Yeah.
Yeah.
And,
Yeah.
and I'm wondering, with all the talk about trauma, people have become much more educated these days. They're reading a lot more. Um, there's this idea that there's big T trauma and little t trauma. Tell the people a little
Mhm.
bit about what the differences between those two are.
Yeah. Big T usually refers to something that is life threatening. So you think about like a natural disaster, like some kind of catastrophic event. Of course, any situation in which your life was at risk, or the integrity of your life was threatened, such as a sexual assault. Those are considered big T traumas. And then little t are situations that are very overwhelming, very distressing, or it could be even witnessing something that was traumatizing to someone else. So it could be things like emotional abuse
Hmm.
from a partner, for example. Um, and those are really the main differences. Unfortunately, the DSM does fall pretty short in terms of the um, traumatic events that they're usually screening for.
Hmm.
We know that a lot of things in life are traumatic, but they're not listed there, such as bullying. Bullying meant people take their lives every year because of bullying, but it's not listed in the DSM as a traumatic event. So that's a good question to point out, is that there's differences between the diagnosable traumatic events versus there's lots of things in life that can be traumatizing.
And that's individualized, obviously. So, you know,
Yeah.
Rachel and I could both be watching, for example, a car accident. One of us could be
Yep.
traumatized and the other not, but it's just how we
Yeah.
perceive it in some ways and how we then
Hmm.
experience it, not just then, but afterwards.
Correct. Yeah. So some of that has to do with were we able to process that event? And that has to do with just how overwhelmed we were in that moment. Did we have the resources internally and around us to cope through that situation? And also what you were bringing into that situation. So if you had a history of other traumatic situations, for example, you might be more susceptible to being triggered or re-traumatized by an event that compared to someone else who may not be having that history coming into that situation. So it's based on your those some of those vulnerabilities there as well.
So, how would you determine then if you have, I guess, been affected by trauma in a way that needs more attention than others? Because it sounds like the description that you just described is maybe some are more severe, some are less severe. So, I mean, I guess how do you know the difference as far as how to treat it or what to do about it?
That's a good question. Um, it really depends on how the individual responds after the event, I guess, in terms of what symptoms they're demonstrating, and then based off of how they're responding, that would tell you, what type of support that individual might need. Sometimes we are able to access our resources again, like internally, our ability to cope and feel safe, and also the people around us to help soothe us and comfort us, and that's enough, and we don't need anything beyond that. But sometimes what happens is for several reasons, our nervous system, our mind was not able to process that, and then it kind of gets stuck, and so we need treatment. We need more focused techniques on helping the brain to process that.
So when you talk about needing treatment, with a good 50%, I believe, of us experiencing trauma at some point in our life, I'm wondering, how does that show up day to day that people would then recognize, well, this is happening to me quite frequently, or just every once in a while even. Do I need therapy? Do I need treatment? What do I need? Like, how does somebody then decide, is that something to go pursue or not? And then also a follow-up to that is, when you are going to seek treatment, what should you look for in a therapist to help you with trauma?
Mm. Yeah, so to answer your first question, individuals who are struggling with trauma day to day, some of the things that they experience are challenges in their interpersonal relationships. A lot of times that's due to not feeling safe with other people, not feeling that the world is safe. So it's really difficult for them to um, engage in those relationships around them. They can experience very intense anxiety, intense depression, feelings of suicidality, um, you know, and symptoms that just overall are interfering with their functioning. What I hear from the individuals that I work with is that, um, you know, a light has been put out in them. They're not the person that they were. They feel broken, and then because of feeling that way, they sort of experience a spiral in depression and not being able to feel motivated to do their day and even take care of themselves like they normally do. And that's usually a sign that you need to get some more help if you're not able to access the support that you might normally have, or you don't have support to help you get through that, that you would want to then reach out to get some treatment. And then in terms of what you're looking for in a therapist, if you're specifically with trauma, would look for a therapist who is screening for trauma symptoms. So they are looking at that as something that could be happening for you, even if you're not aware of having been traumatized. Or a lot, it's not uncommon for individuals to go through an experience and not realize that what they went through was a trauma. Because again, a lot of times people are aware of those big T traumas, and so they'll say something like, well, I wasn't, I didn't, someone didn't threaten my life, or I wasn't in a big fiery car accident, so I should be fine, right? They don't always even have the awareness of the things that have traumatized them. So being able to have a therapist who understands, just being trauma informed, they understand big T trauma, little T trauma, they understand the things that can be traumatic for an individual, they understand the symptoms of trauma. And if you're looking for trauma treatment, you would want to, look for a therapist that has training or certification in a specific trauma treatment modality, such as EMDR, which is what we provide in the program.
And so people understand, EMDR stands for eye movement desensitization reprocessing, right?
Correct.
Okay. And
Yep.
that's well researched. It's all over the internet. Anybody can look that up and get a little bit more information about that. I don't know
Yep.
if
It's actually, yep.
Yeah, I was going to say, I'm not sure. I know we had some people already send in questions, but for those of you logged in, does anybody have questions that you guys would like answered by Lauren before we hop onto those questions? So, Lauren, we had some people message in instead.
Okay.
So, I just want to ask you a couple. So first question, some of these kind of overlap each other, but first question is how can we expect to thrive with all that's happened this year? There's so much trauma that's happened for so many people. Again, vague question, but if you kind of had to answer that, what comes to mind for you?
Yeah, well, I would say that's a question that's been asked a lot this year. First of all, I would just recognize that we don't have to um, expect ourselves to thrive in the moment of going through a traumatic event. It is okay to be just figuring out how we're going to get through our day, how we're going to take care of ourselves. And when we're going through something traumatic, just part of thriving is being able to overcome the trauma and what has happened to us. And so being able to understand that it's okay if you don't feel like you're thriving in this moment because you might be going through a trauma or a trauma is still happening to you. But to know that that you are able to thrive from traumatic events. One of the things that I wanted to say is that I think overall, as human beings, we underestimate ourselves in moments of trauma when times are really difficult and hard. But the reality is, these are the moments of our most potential, of our growth. And we get to see how strong we are. And we don't realize that when we're obviously going through that challenging moment at the time. But that's what comes out of trauma, is being able to really see our strength.
If I could, Lauren, one of the things that you talked about is to recognize that during the trauma, we may not be thriving. And, one of the things that Rachel, you and I have talked a lot about on these podcasts is the idea of being okay with how we are right now and whatever we're experiencing, and to validate that, like acknowledge that this is really hard, or this is really scary, or this is really upsetting to me, or I feel really bad about this, or I'm really worried about this. And to be able to have some grace with ourselves and some ways of comforting ourselves, to allowing ourselves to see that this is hard, or this is, upsetting, and it's okay if I'm crying, or if it's okay if I'm, withdrawing right now because of whatever I'm going through is real. And, that doesn't mean, like you said, that I can't thrive again or even right after this. It's just that right now it's hard.
Right, exactly. Because, some people who are, for example, having a really difficult time this year may have actually overcome things before in their life that were traumatic. And so it's reminding ourselves that I have gotten through things before. This might be very different, but I can recall what resources did I use, what support did I get, how did I get through that, and I can do that again.
Definitely. That's a great point. I think, one of the things that I would imagine people who are listening or will be listening later to the podcast, that they want to know, what can I do? How do I manage this?
Yeah, that was what a couple of the other questions were, is like, it was exactly that. So if I'm not in a place to want to maybe go get treatment, or, to come in for anything intensive, what do I do each day when I feel like I'm being triggered over and over again? We had one person ask, if I'm being traumatized by my family, but I live with them, how can I thrive in a setting that I can't escape, if you will? And then another question we had was just, in the world right now, I mean, there's a lot going on, a lot of unknown. So the question was, I feel like I'm being re-traumatized every day. And so how do you thrive when it just feels like you're going to keep getting traumatized? And loaded question, but I'm curious about what your feedback would be.
No, it's a good question. I think it goes back to what Lou was saying, which is, first we validate that, yes, I am being re-triggered. Yes, this can be re-traumatizing for me. So we don't have to minimize that or be in denial of that or try to kind of just push that down. And at the same time, we want to be able to recognize that we can, again, look at what resources we have. One of the things about being traumatized and being triggered, especially when you're living with your family, is knowing that we don't really have that sense of safety in the world around us. And that's what's really being taken away from us. I think it was Dr. Bessel van der Kolk who spoke about trauma being the three things of, not having control over what's happening to me, a sense of danger, and unpredictability. And when we have those three things, we have the equation basically for a traumatic event. And that's exactly what the pandemic is. That's exactly what some of the things that have happened this year in this country have been for people. And that's what happens within families as well, too, if you're living in a family that is abusive or traumatizing. And so one of the things that can help us is to have a sense of self-agency and being able to say, this is what I'm going to do with my day. This and really creating a routine for yourself. And this is something that a lot of people struggle with during the quarantine, is feeling like they couldn't go out, they couldn't do the things that they wanted to do. And so instead of focusing on what we don't have control over, what do we have control over in our lives? Can I decide what I make myself for breakfast, who I FaceTime later today, doing a reading, doing a meditation? What are the things that I can control in my day that I can focus on so I can get that sense of being able to take care of myself?
That's the hardest part, because that the verbiage that we use is I am losing control, and so we think I'm losing control over everything is the interpretation. So I like that you're highlighting the things that I do have control over and the things that haven't changed. It feels like so much has changed this year, and maybe outside of this year for a lot of us, but this year in particular, so much has changed. It feels like everything around me is changing, when in reality, to your point, does my breakfast routine have to change? As silly as that sounds, does my breakfast have to change? No, I can still get up every day at, whatever time I get up and eat breakfast, and so identifying those little things, I think, really does make us feel more capable and empowered, and kind of shifting the mindset of I have no control over anything, or I feel like I don't have a lot of control.
I think that's really important for all of us to recognize that those little things, we may minimize that and say that they're little things, yet when they collectively come together, they really are what sustain us and get us through things. It's part of what contributes to the resiliency that we all have, is being able to continuously do those things that we do have control over, that we feel some sense of confidence in, and feel like this is something that nothing can be taken away from me. I can't be, hurt in any way from being able to do this.
Right, exactly. And it can be those simple things, and every day can be the same too. That's okay if you have that routine and that breakfast or the reading or whatever it is that is in your control to do, and it can be that way every day. That's okay.
If you were to highlight like the top 3-4 things that anybody who has experienced trauma could do that would help them get through day to day, help them manage and thrive, right? That's what we're always talking about. What would you say, Lauren, would hit that list?
You're putting her on the spot right now?
I am.
Sorry.
It's all the things. Well, definitely taking it I know it sounds corny, like one day at a time, sometimes 1 hour at a time is what we have to do. So being patient with ourselves, again, like whatever the expectations are that we have for ourselves, it's okay if we're not where we were at or where we think we should be at. We can validate where we are. What else would I say? Reaching out for help. There's so many people who are going through this, and I know particularly right now it can feel very isolated what we're going through, because we're literally isolated at times. But whether it's using social media, I mean, I can't tell you how many people get sounds like some pretty decent information from maybe TikTok or Instagram, like if it's like a board they're following, or they find a support group. But just being able to connect, whether it's on the internet, or if that's safe enough to do, to know that you're not alone, and that you can get support. And then just being able to to know what your resources are out there. Even if you're not ready to do treatment, you can reach out to like a, I don't know, like a crisis line, if that's, if you're at that point. But if not, just knowing that you can look into what options are out there, and that, you can just try and take good care of yourself each day. Again, if it's like, sometimes in my group we talk about like, if your goal for the day was to get out of bed and change out of your pajamas, like that's okay. You can make small goals for yourself. And I guess the biggest thing that we talk about in terms of what we do on a day to day is try to be compassionate with ourselves, which is definitely one of the easier said than done things. Which just looks like, if this were my best friend, if this were my child, how would I talk to them? Would I be saying the things that I'm saying to myself? Because a lot of times we're just being really hard on ourselves. And so just trying to practice some self-compassion helps us to be able to heal.
I think that last one in particular is so key, as you were highlighting it. It's so hard to do, especially if we've experienced trauma. There's so much mixed emotions that go along with that. The sense of anger and rage, yet also sometimes guilt and self-blame and
lack of trust.
Lack of trust, especially lack of trust. Not only lack of trust of others, but lack of ourselves and abilities to make good decisions. So being able to have some self-compassion is huge. It goes such a long way. I'm wondering, I don't know how much more time we have.
I think we're running out.
We're running out. I don't know if there's any other questions that anybody else.
No, there's a few of you logged in. I'm not sure if you're just on to listen or if you guys had any questions, but the floor is yours if you have any.
I do have a question.
Wonderful.
I know that my trauma tends to make it very easy for me to avoid things. And speaking with what Dr. Lee said with lack of trust, and I kind of don't trust myself to kind of put myself in that situation or in situations that feel the same. What would you suggest is the first step to combat that avoidance?
And maybe even trusting yourself, it sounds like, which kind of leads into that avoidance. Okay. Did you hear that, Lauren? I'm not sure how well hooked up we are.
Yeah.
Okay. Yeah. I heard that. That's a really good question. In terms of being able to trust yourself, it sounds like it comes down to what feels safe. And again, when we have gone through trauma, it's our sense of safety that has been taken away from us. And so when we're going into a situation, there could possibly be something about that that's not safe for us. So it can help sometimes to start really small with the people that you can trust, even if it's just one person. And sometimes we don't have just that one person. And it's okay if that trust starts with a therapist or a helper in your life. And that we practice building trust in that relationship. And then we take other baby steps to practice trusting, because the thing with avoidance is that it definitely is something that we use to protect ourselves from being hurt again. We just don't want it to run our life, because then our world ends up getting very small. So little by little, finding ways that we can build trust, and hopefully with safe people or in safe places to start if we have those.
And one other thing that I would add, as you were talking, Lauren, made me think about the idea of building on things and thinking about trauma responses to going through life. We often look at what we're about to do, and we continuously are looking at the trauma and evaluating things through that lens, as opposed to experiencing right here and now, and then using our senses of being able to see, hear, touch, and evaluate, is this okay? And being able to differentiate now and back then.
Right.
And I think a lot of times we blur that with trauma, or habits too. Like a lot of times, anxiety and depression follow that same pattern of avoidance and recognizing whatever we're doing, but evaluating it through a negative lens. And so I often encourage people to take a step back and see this as a fresh glance, if you will, at what we're doing and evaluating, is this okay? And as you said, Lauren, checking it out with somebody that we trust, and that might be a therapist, it might be a friend, it might be a support, it might be a sibling.
Yeah, I just want to say that's a really important part of trauma treatment. We often talk about orienting ourselves back to the present, because it's very real that being stuck in trauma time, it's actually a part in our brain that has not been moved over to the hippocampus. Like, it's actually not in our memories yet. So it does very much feel like it's happening right now. And what's important to know is that you don't have to have processed your traumatic memories in order to recognize you've been triggered and bring yourself back to the present, to the here and now, where it is safe. And that's a big part of trauma treatment.
I was gonna say, I wish we had like a whole other hour, because I could totally geek out on the brain, and I know you could too, Lauren, because I just think it's so fascinating. But I want to kind of reflect back on something we were talking about a minute ago, and that you mentioned, of self-compassion. And like you said, it is very real. And even though our logical part of our brain might understand that this thing isn't happening in this moment, my body just doesn't feel that. It doesn't, we're not in a place of believing that or being able to ground in that, which is why I agree. I think it's so important to kind of ground myself back in my reality, whether it's, touching something or seeing something or feeling, whatever it might be, to kind of ground ourselves, because I think it is really hard to decipher, even if you logically understand, I'm okay, I'm safe, by seeing. It's not believable to my body, and it's really important to give ourselves compassion around that it sucks that I can't just believe myself. It's so hard.
I know you've often talked about how the brain, cognitively we can tell ourselves we're okay, but my heart's still pounding. Right? So I'm having a hard time believing what I'm telling myself, because I'm still freaking out inside. And so there's a game of catch up, I think, that needs to be understood, that our bodies are kind of behind in some ways from what we tell ourselves sometimes. And so when we are trying to tell ourselves we're okay, but our body is still kind of anxious, it takes a while to balance that out and to catch up and get on the same page. So again, the compassion that, Lauren, you pointed out is really, really key right there, to allow ourselves to understand that and be compassionate and allow ourselves to catch up, if you will.
And maybe even a reminder to answer the question that you had just asked, is this idea of, if I feel one way, it doesn't necessarily mean it is this way, and trying really hard to separate the two of those as much as possible, which, Lauren, I'm sure you could go into a lot more detail at another time about how that's a lot harder and easier said than done, but something to kind of remind yourself that it's not all on you, to be compassionate to yourself, I think is a really big step.
Yeah, it takes a lot of practice.
For sure.
Yeah. Absolutely. Yeah. And I just wanted to say, last thing is, like, working through the shame, like, that is really what's at the root of the difficulties with self-compassion. And it is no small feat. It actually, what takes the bulk of time in therapy is really working on coming out of that shame. And part of coming out of shame is coming out of hiding and saying what happened to me and asking for help and being vulnerable, which is also an act of self-compassion. And there's lots of ways to practice that, and it takes a lot of time. So again, just be patient with ourselves through that process.
Great point, Lauren. Yeah.
Well, thank you so much for all of you who logged in. Thank you for the questions that you guys either sent in or asked live here today. Lauren, we really appreciated having you tonight.
It was so nice to have you.
Hopefully in the future we can do it again, have a follow-up. It was awesome. So if anybody has any follow-up questions that came up post tonight, please feel free to send them in, and we can forward them to Lauren. I'm sure she'd be happy to answer some questions if there are any more. And if anybody wants to get in touch with Lauren, like I said, she is our lead trauma therapist through Sonare, runs both of our complex and our not simple trauma, general
Traditional.
trauma track at Sonare today. So if you guys need to get in touch with her, that's the best probably way to go through it. So thank you again. Hope to see you guys next week for another episode of Thriving with Rachael and Dr. Lou. Have a good night.
See you guys.
Bye.